Hi, I'm Dr. Randy Oppenheimer, and I am the Chief of Otolaryngology Head and Neck Surgery at Maricopa Medical Center. One of the few cancers that's rising in incidence is throat cancer in men between the ages of 40 and 60. And when I say throat cancer, it mainly involves cancers in the tonsil and the back of the tongue. Usually this has been ascribed to smoking and drinking. However, the past 10-15 years, we found that there's an increase in this type of cancer due to the human papillomavirus. Human papillomavirus has previously been associated with cervical cancer in women. It's been found that this HPV virus is a sexually transmitted problem, and we found that it's mainly due to oral sex. Research has found that your risk of transmitting the HPV virus is increased with the number of sexual partners you have. There isn't a lot you can do to prevent HPV-related cancer except by stop having oral sex. Or at least you can lower your risk factors by limiting the number of sexual partners you have. The way we diagnose this type of cancer is a patient will present with a swollen gland in their neck. If a person feels they have a swollen gland, first of all, if they've had a recent throat infection or sinus infection or even a tooth infection, a normal reaction is to get a swollen gland. That's how the body fights infection. There's a lot of reasons for swollen glands, and every person who has a swollen gland certainly doesn't have cancer. However, if you get that swollen gland and it doesn't go away, or if you get a swollen gland and don't have any of those reasons, that's something that needs to be investigated. The best way to look into that first is to talk to your primary care doctor and have them examine you. And if they're suspicious, then they will refer you to someone like me. Once this is diagnosed and we find they have cancer, it is treatable. Depending on the stage of the cancer, usually it's a combination of either surgery and radiation, or chemotherapy and radiation. The best thing about this type of cancer is that it's very responsive to chemotherapy and radiation. And we're seeing very good results.